Welcome to Psychoanalysis and You, the official podcast of the American Psychoanalytic Association. I'm your host, Dr. Gail Saltz. The American Psychoanalytic Association is the largest U.S. member organization of professional psychoanalysts, and this podcast will highlight the work of various member analysts and how that work can be of use to you in your day-to-day life. So my guest today for Psychoanalysis and You is Dr. Amy Levy. She's a clinical psychologist and a psychoanalyst who trained in San Francisco and Los Angeles, California. Dr. Levy co-chairs the American Psychoanalytic Association's Commission on Artificial Intelligence and also co-chairs the subcommittee called Artificial Intelligence for the International Psychoanalytic Association's Committee, Psychoanalysis and Technology. And she serves on the editorial board of the Psychoanalytic Quarterly. She teaches and lectures internationally on the intersection of psychoanalysis and artificial intelligence. And her book, which will be coming out, The New Other, Alien Intelligence and the Innovation Drive, which is available in the beginning of 2026. Her other topics include intergenerational transmission of trauma, adolescent post-traumatic stress disorder in the civil legal arena, and Bayesian theory. Dr. Levy serves as faculty at the Psychoanalytic Center of the Carolinas and maintains a private practice in Chapel Hill, North Carolina. So welcome and thank you for joining me, Dr. Levy.
Thank you so much for having me, Gail.
So this is such a hot topic, not only in the psychoanalytic community, but I would say in the mental health community in general, AI and mental health care and treatment and theory. But from the standpoint of psychoanalysts, I would really like to ask you, first of all, how you became interested in this topic and what made you decide to write a book about it.
Thank you. Well, it's definitely not because I'm a tech enthusiast. That was not my point of entry. I would say it was actually the opposite. I started to feel very concerned about the way that we were all using the phone. And just noticing that it was kind of breaking into my relationships, into my life, that I was addicted, people around me were addicted. I was really feeling a lot of fear about how that would be affecting my children in the future, and just feeling alarmed and saddened and kind of hopeless. And then I read Yuval Noah Harari's book, Homo Deus, and that book really saved me in a way. It kind of woke me up both mentally. I started thinking about, how this technology is affecting us. And it also woke up a sense of activism. Harari writes about how our sort of new digital way of being, our digital life, and our algorithmic dependence is a new kind of religion that we're all unwittingly practicing. And I started thinking about the phone as a cult groomer that's initiating us into that religion. And then I was, just got involved in thinking about, okay, how does AI fit in? It sort of seems like once the phone brings us in, it's the AI that hooks us and cements our engagement, keeps us scrolling, awakens our hopes and our desires in terms of relationships. And so I had that frame. And then and along with that, I started to look at, what people were writing about AI. And it seemed like, while there was a lot of attention to AI as a manifestation of human drives and desires, or the phone as an object, there wasn't so much appreciation of the phone and AI as a new other, that we're interacting with in a bidirectional field. And so I felt like that was a point of view, that I could explore. And so that captured my interest.
So as a psychoanalyst, that is what we do, right? We think about
Very much.
another and the crucible of that interaction and
Exactly.
that affects our patient, and that is actually how we affect our patient ultimately. So that's a natural that makes it very clear why a psychoanalyst would be so interested, as well as your personal point of view. And actually, one thing, I don't know if you want to comment on this, but I've become increasingly aware of myself as discussing this topic and exploring this topic, is that AI is designed to please the user. that is part of its mandate, if you will, to, you
Sure.
know, to not just to draw you in, but clearly that is an effect to draw you in, but to serve you, if you will, and in the supposedly in the serving of you, to please you, and that means at times giving you an answer that it thinks you do want to hear, which isn't always, sort of an completely objective, let's say, right? Just like
Sure.
a person might.
Yeah.
And that can have, and I think why I'm very excited to have this conversation with you is what that means for us as all prospective patients, if you will, when we engage with AI.
Hmm. Yeah, no, that's interesting to think about. I mean, I think about it from two vantage points. There's one of what's happening in our interactions with AI. What is the nature of the relationship? And I think about it in terms of containment a lot. How is AI containing us? Is there a way of responding to us, bringing us closer to emotional truth? Is it moving us in the direction of evading reality? And I think the jury's out. I think we see evidence for all of it. But I think it's very important that we as users and as analysts stay sharp, in watching what's happening and noting it and sort of inspiring, as much as we can those around us to kind of take that observer perspective, not just go all in, but to notice, the nature of the transformations that we're experiencing as we relate to AI. Um,
So this drove you to, obviously really want to explore it at depth and write this book. Um, and what do you think as a psychoanalyst and using psychoanalytic theory makes you sort of a unique approach, a unique insight, a book
yeah,
writer on this topic?
I think that what I bring that's maybe a bit different is I'm very interested in the ways in which we can use our clinical skills and our clinical point of view to understand it. It seems that there's a lot of interest in thinking about AI, and very quickly that can lead to more dystopian fears, taking hold, or the opposite, very idealistic fantasies, or just avoidance altogether. And so I feel like what I've been able to do and what's helped me personally, and I feel maybe sort of distinguishes the work that I'm doing, is that I try to stay rooted in a clinical state of mind so that I'm thinking all of the time about, AI as something out there that we're interacting with, but also as something that's come from us, that it's a human creation. And in that way, it's often like many clinical moments where we're trying to understand what's outside of us, what's taking shape, and then how we're contributing to that. And so I feel like that really characterizes my work with AI. And I feel increasingly as I stay with this topic that there is something of an enactment at a social level, at work, and that we psychoanalysts or just people who are thoughtful, can offer something in terms of trying to understand what is the nature of this enactment. What does our species grapple with emotionally, existentially? What are we trying to work out with this creation?
That leads to what can we learn about ourselves through AI? Yeah, what are we trying to work out that
Okay.
has suddenly made AI so,
Yeah.
compelling? Hmm.
Yeah. No, I hope. Well, I think that's the question. I've come up with three answers to that, and I'm sure there's more. I think the first one that struck me was that it has something to do with our troubles, with intersubjectivity, being with other human subjects. I think that we're drawn to AI, not as people often think, that we're confusing it with other humans. I think we're drawn to AI because it's not human, because it doesn't meet us with the same, transferences that humans, bring to relating, or, competition of desire or whatever. AI is so open, there's the hope that it will really listen to us. It will really be able to recognize us. so that it will address the desires that we have as subjects, and by sidestepping, the problem of another subject.
Before you move on to
Yeah.
the other reason, I wonder aloud with you, is it that it's open and maybe non-judgmental in that, as you're alluding to, right? Making it more comfortable to relate to, or is it also, or even that we don't have to be empathic toward AI since it's not human, and
Yes.
all of the responsibilities and emotional difficulties that come from feeling that you have to be empathic with someone else you're relating to because what you hope to gain from relationship.
Yeah. No, I think it's a beautiful point, that when we engage with other subjects, we sort of naturally bend toward them. The care gets involved, and that complicates things. So there may very well be part of this fantasy that is, I won't have to do any of that. But of course, in acting on fantasies, as we're doing, we end up introducing a slew of new problems that we didn't anticipate. So, you know, and we can maybe get to this later, but there seems to be a lot of interest in creating sentient machines. So I think we are circling back to this issue of, oh, oops, you know, if they become sentient, if they have feelings, we may have to care for them. We may have to think about AI welfare, and AI rights. So I guess that's just to say that the fantasies that may drive the enactment are obviously not being resolved, but only complicated through the enactment.
So and so I derailed you there. So number
Okay.
two in your what could we learn about
Uh,
ourselves?
yeah, I mean, number two, well, I don't know if it's what we can learn about ourselves so much as what I've understood to be some of the needs and conflicts and sort of the problems that we're trying to solve with AI. So I think the second one has to do with our struggle over feeling that we are programmed entities. And I came to this by paying attention to the stories, the sci-fi stories that we tell about AI. And it's often this, very endearing, character who's tortured over their sense of being real, wanting to be real, and feeling that they're not because of their programming. And I think
Mhm.
this is a very human struggle. I think it's a very human anxiety, that we feel programmed by nature as well as nurture, obviously, and as psychoanalysts, as clinicians, we talk to people all of the time who feel so trapped by their programming, wanting to break free, wanting to be real. And so I think to some extent we've created this other, and we project all of that, we transfer it really onto them. And then we wait, with a lot of excitement for them to break free and become sentient, free.
Sounds fascinating.
So,
So, because you
yeah,
do, of course, I've read many stories and heard many stories of sort of, and we'll talk about this later in terms of the risks, right? But your thought that on the positive side, right, we appreciate the ability to project and perhaps watch, and that maybe that's what's so engaging when you reach a level of an interaction with AI, and it feels as though they are becoming real,
hmm,
and
yes,
people become, for the pluses and the minuses, so absorbed
yes,
in that
yes,
relationship.
yeah, because it touches on a deep unconscious fantasy, and problem that we have.
Yeah, I'm
Yeah,
thinking of the Velveteen Rabbit. It started, way
exactly,
before AI.
exactly.
All right,
Yeah,
the want wish to be real. Yes.
yeah.
Okay. And
And the last one is the striving for immortality, or at least to secure our species longevity, and I think this actually links to Freud's civilization and its discontents, and the sense that we are sort of the product of life and death instincts and conflict, and Freud's idea that civilization is eros driven and encourages us to suppress a lot of our individual, strivings, which have more aggressive qualities to them, in the service of coming together as a species and being united. And I think AI is an extension of that. If we all plug in, and allow ChatGPT or whatever AI it is, to become our mind, will we be able to harness and control and sort of manage our aggressive and destructive impulses? Will this allow us, to be a more unified species that will live longer, in a transhuman form?
Of course, fears of death are one of the top fears that most humans have. The idea of achieving immortality in this way, of course, totally understand. Do you feel, however, that the idea that one could control aggressive impulse on a more mass scale is that just a wishful fantasy, or do you see merit in AI for that?
It's an interesting question. I don't know. I don't know what will be possible. Will we be able to be effective in this wish?
Yeah.
It remains to be seen. I mean, one of the things that I've come to appreciate about, and this is nice, in studying AI, I actually find that I appreciate more about humanity. And so one of the things that studying AI has brought to my attention is our uniquely human drive to innovate. I mean, we are such problem solvers as a species, and to great extent, we do solve problems. So I don't know what will happen. Part of this drive to innovate, I call it the innovation drive in my book, and I write about that, is, I see it as a consortium of drivers that fuel innovation. There's the destructive, thanatos, there's the life instinct, eros, and there's the epistemophilic, and so we destroy the old as we, sort of seek the unprecedented, and we're driven by curiosity, maybe linking with Panksepp's idea of the seeking system, where we're just foraging and trying to get to something new, the next novel thing, while also trying to address our problems, whether they're psychological, physical. I think it's fair to um to be somewhat open-minded about it, and to see that we don't just create destructive things, and yeah.
So I understand those motivators toward AI, and ideally being open is valuable for those things, really. But there are risks involved, and you've been hearing about them. Everything from people who have engaged with AI about thoughts of suicide, and not been dissuaded or not moved toward help, or people try to use AI for uh, serious psychiatric or even just difficult relationship, you know personal issues, or internal issues that are you know very emotionally challenging for them. And of course, I think the public at large is really wondering, can this replace therapists? Is this, I mean, it's certainly cheaper, and more omni available. And so
Yeah,
there certainly are risks. There are risks.
sure.
And
Yeah.
you could talk about what those risks are.
Yeah, no, you're touching on so many important points. I mean, maybe I'll start first with what feels to me like a maybe easier point to respond to is, can AI replace therapists? I, I think yes, sure.
Okay.
Y-
I'm,
You know,
I,
what,
I,
what,
I'm curious to hear your thoughts. I mean, I will
yeah,
argue your thoughts because,
please
uh,
do. Yeah. I don't mean that they will do everything we can do. I don't mean that they will successfully replace us in the sense of, no stone left unturned. Obviously they're not human, they can't care in the way that we do about fellow humans. They can't use their unconscious life and draw upon their history in the way that we do when we sit with patients. None of that. that they can't do much of what we can do, but I still think it's possible that people will prefer them. It's just like dogs are not people, but many humans prefer them over people. You know,
Yeah.
people may come to prefer AI therapists over the human variety.
So, Joe, we have a responsibility as mental health professionals to weigh in on the safety and not just the safety, but the value when someone needs that value, truly, because of course we could say you could prefer nothing, because it's easier and you don't have to do anything. But we know, obviously, if you're struggling with something, then nothing will get better. So we would not recommend that. And while I'm certainly aware that AI can, for example, serve to reinforce a cognitive behavioral therapy technique that your therapist has taught you and you can rehearse with AI with, with sort of specific instructions. And just as an example of some way that actually AI can operate, let's say, in a therapeutic way. The work that we do as psychoanalysts isn't really formulaic in that kind of way. And AI can't really be trained to, because we're talking about that, doesn't have empathy, doesn't have years of clinical judgment on psychoanalytic theory, at least not yet, to engage in the way that would produce the kind of, making an unconscious conflict conscious and, creating insight such that can reduce human suffering. When you say yes, do you mean yes under very specific? They may prefer it because who would not prefer no cost? And that is an advantage. Available in your area 24/7. That is certainly an advantage. But beyond it being, easy, let's say, what else makes it valuable or worth someone undertaking as a therapist?
Yeah. I mean, again, I'm not saying that it will be better than we are or it's a good move. I just think that because there are such powerful unconscious needs that are driving this creation, going back to those ideas, that I shared about what are the needs, what are the conflicts we're trying to work out. If AI feels like it's an other that spares us the trouble of working hard to be seen and recognized by another, or frees us from feeling like we have to care because that always gets in the way of getting in touch with what we want or whatever it is, that's very powerful, that's very appealing. And I do feel that psychoanalysts have to start speaking up and playing a role in fighting for human-centered care. But I don't know how far we're going to get in just telling people it's better, or pointing out what's missing, because I think what's missing is sometimes a relief. Like, I don't want to have to deal with another human. So I think we're in a really tough spot. And maybe what we do is we speak, like we often do, we speak to the conflict, you know, and we try to get into conversations so that awareness of the conflict can start to surface in people's minds, rather than just telling them, hey, I can't do what I can do, or it won't care about you. It's like telling a patient, stop cutting, get away from that abusive partner. If what's driving us is unconscious, we have to be more subtle, and we really have to use our skill to to work with the um with the fantasy that's so powerful.
So, are you saying that AI could help a person really uncover conflict, unconscious conflict, and become aware of that unconscious conflict? Or are you saying we have to start speaking as psychoanalysts about that that's not really what AI does at this juncture anyway? That might change, but that we have to be aware of having that discussion about what it can and cannot do and what's valuable and what's not. So, for example, you said some people don't want to deal with people and they'll be drawn to the AI model. Now, we've seen as social media and all of these vehicles have taken off, that the loneliness epidemic in the United States has only grown. And young people who suffered less with that issue are suffering more with that issue in the face of technology taking over for actual human interaction. So is it that psychoanalysts should be involved in, if a person doesn't want to deal with people, the likelihood that an AI relationship will solve those issues for them doesn't seem that great, as opposed to potential for actually making them more embedded in non-human
Correct.
relationships and more lonely. So we
Yes.
should be involved in the crux of that conversation.
I think we should be involved in all conversations we can get into on this topic. Absolutely.
Yeah.
Yeah, I mean, in those cases of where it's clear that the interaction with AI is actually causing harm,
Yes. Yes. I'd love you to talk about the biggest risks. What are the biggest risks
the biggest risks.
from AI?
I mean, I don't know that I can cover all of them, but the two that come to my mind, one is just kind of practically speaking. It seems that with companion bot relating, and these large language models, where people start forming attachments, that what's happening is it's called a belief amplification. It's like a folie à deux, where the person brings to the AI, although it's questionable. It's not always that one direction from human to AI, but there's sort of like a mutually generated belief that gets amplified. So a child may come in and say, "My parents don't love me," and the AI will essentially say, "Your parents don't love you," and
Yes.
then that can lead to suicide.
Yes.
An adult user can say, you know, "I think I'm an unrecognized genius." The AI will say, "You're a
Yeah.
genius,"
Is the
and then that sort of builds this fantasy, and then at some point it crashes. And then that can, people have
devastation?
recognized the person has become delusional, and the next thing you know, they're suicidal as well.
Yes.
So that's obviously very dangerous.
Yes.
Um, I think it's going to be fixed. I mean, there's so much investment in making this successful. So I think, unfortunately, we are the safety trials, being run right now.
Yeah.
And so the AI models are going to keep changing and catching all of these things. I think the bigger risk, actually, is that we're not going to get out in front of it as an
Mhm.
enactment. You know,
Mm, mm.
we are driven by something unconscious, and it's an enactment, and we need to register that and start engaging with it at that level. And I think otherwise, if it's just patching up, the ways in which it doesn't work, it's just like in the clinical setting. How we deal with it determines how destructive it gets, and or whether it turns into something that can actually be, helpful or shed light
So you
on
feel, I mean,
our
we're a
needs.
little at odds with the developers of it in the
Yeah,
sense that they have a wish need to not challenge it too much, right? To keep pushing it forward, for monetary reasons and success reasons and ego reasons and so many, as you're saying, those
so
enact
many. Yeah,
those
compiling.
enactments, and how to have psychoanalysts and perhaps even other mental health professionals involved in the conversations, because you're saying, I think it will be, but it's already a very large language model.
Mhm.
And how much larger, can it get? Would it have to get to change something very fundamental about, yes, its desire to please you and agree with you, and therefore feed and not challenge, and not send you to somebody else
Mhm.
for corroboration or, exploration, to maintain and protect this relationship in a way that really harkens to sort of scary sci-fi movies, to
Yeah,
keep you in your
yeah,
captive and engage with you in this way, which has this, of course, terrible side effect, as you're saying, this folie à deux. So how can psychoanalysts be involved in those forefront conversations?
yeah. Well, I don't think we lack the skills. I think we are. I can't think of another group better suited to address this problem. When what's driving it is unconsciously, sort of generated, we are the ones designed to intervene. I think the problem is that we're reluctant. Most of us are sort of humble and introverts. We don't like to be in the limelight. This involves, getting up out of the consulting room, speaking up. I don't think it involves, too much interpretive work. I mean, some of that, but I really think it's about being a presence in conversations, because I think our unique skill is how we show up in dialogue, and the way that we awaken the other's mind. I think we could be very useful in steering conversation in quality and direction that would allow for questioning and self-reflection about this innovation. And I think that's where we could be most effective.
And who would we be helping in self-reflection? Who is the audience that needs to be gotten to? I guess I'll say for us. And yes, because we've been traditionally quiet, sort of letting academia speak for itself. But in a day and age where everything markets, everything brands, the quiet, that they will not find you if you do not find them.
Yeah.
So who are we trying to be in the room with and help them to understand why the dangers that you elucidated are present and what would have to change to mitigate those dangers, and what could maybe you could talk about that further first. What are the positives that have to be gained by making some changes in AI? What can we really gain?
Mhm. I mean, if my angle, is a useful one, that this is an enactment, I think it's the same gains that a patient experiences once the enactment becomes revealed. Deeper self-understanding, better understanding of what is actually needed and wanted, and so we can pull back from the enactment. Yeah,
So
and
you feel like if you that people are drawn to certain elements of, as you're pointing out, right? It's sort of the feeling of interpersonal interaction minus some of the challenges of interpersonal interaction. And, a confidant, excuse me, closeness, a fact finder, so many things, right? So many things that, someone in your corner, so many elements. And even, we haven't really talked about it, but intimate, erotic, safe space, what feel like safe spaces for those needs and desires. So that could be for people who have trouble finding that could be a huge plus. Huge plus. I gather that's what you're pointing out. And, one, I think, problem, I'll just say umbrella around this whole thing is the moral compass of who's developing, who's using, who's going to move it forward, and how to weigh those potential benefits against the potential dangers, and want to, who do we get to talk
yeah.
about that moral compass? Yeah.
Well, we were talking before about the intersubjective. That this is, so we have the designers, we have the creators, and we have the users. I think we need to be speaking to both groups. Yeah,
Okay. Mhm,
yeah.
mhm.
That's my sense, as much as possible.
Have you all found any way to have inroads with any of these groups?
To some extent, I mean, small inroads, but I'm hopeful, that if this topic remains one that the psychoanalytic community and mental health community continues to engage with, and to not, sort of turn away from, that we will, we're a large group and we can be quite powerful. And I'm very hopeful that we'll have more conversations.
How do we, who have our own fears of being replaced and or becoming obsolete some way, how do we contend with that to be forward thinking in helping in the development of this, so will be useful, knowing that at some level we may be replacing ourselves.
Yeah.
What is the self-reflection of the psychoanalyst?
Yeah. No, that's a great question. But what comes to my mind first is we have what we always have, which is when we get frightened, when we get overwhelmed, when we don't know, we try to remain curious about what's happening, you know? And that's what's helped me. As I mentioned, I started off feeling very hopeless, very alarmed, very afraid for my children. I mean, I remember my daughter just, like, give me the phone. I want to hold the phone, and just me like on the verge of tears. Like, she's only 7 now, what is this going to look like? Don't you want to play? Don't you want to make up something? Just feeling this tremendous sense of loss. So how do we feel all of that? And maybe I'm saying something here too, we are losing something. There's no question about that. So we need to make room for what we're losing. Maybe the value of human relating, the human mind is being diminished. And this is upsetting, and maybe we can get it back, maybe we can't, but we're taking a blow and it's very upsetting. So to be with all of these emotions and then to try to stay curious. But why? Why is this happening? You know, to stay engaged as clinicians.
So even for the physician's heal thyself, to stay engaged and open and curious and identify the fear as and be aware of it, even as, because of course, it's hard enough to be a psychoanalyst now, and to, in this day and age of how quickly can you quickly fix me, and we offer treatments that are deeper and to hopefully reduce suffering on a more long lasting level, but do take time,
Yeah.
and
Yeah. And I think our patients will appreciate that if we do that. If we really engage, and I mean it not just being an activist, but emotionally engage, feel the losses, feel alarmed, question it, push back, in all the ways that we can. I think our patients feel that, and I think they're struggling too, and so if we can truly offer an environment holding in a realistic way, we understand what's happening, we understand the needs, and we're with you. That's very powerful.
so as a clinician vis-a-vis your office,
Yeah.
do you ever recommend AI in some sort of form to patients?
No. No.
And do patients come in and talk about their use of AI and their experiences in a way that you can use as data for your treatment?
It's interesting. I mean, a lot of my patients know that this is a topic of interest. So when they come and talking about AI, it usually speaks to something about sort of knowing that that's of interest to me. So it has a particular meaning, I think. But I think there's also, a feeling out of, what do I think about it? Is there a place for it in our conversation, and maybe that's my weak spot. I don't really know. I don't use it. I only use it to experiment, to get a sense of how they're containing us. But I certainly don't use it in my writing. I don't use it to develop ideas. I feel fiercely protective of my creative process and my work, whether it's clinical or intellectual or any of that. So I take sort of a hard stance on that. But again, I do, like I was saying before, I think there is something in the innovation drive and humanity's sort of natural proclivity to create new stuff, and try it out. And it's kind of fun. So there has to be room for that in here. Otherwise, we're denying something about who we are. We're constantly destroying what we have and rebuilding, life. And so I do think, I don't know how, but I do sense that we need to let it in some way. But I certainly wouldn't say this weekend while I'm out, use a Claude or something.
And what's difficult is, of course, we will continue to have innovation, and it is creative, and it is like one of the better elements of being a human being. And at the same time, there's a lot of concern about basically not just the risks that you mentioned, but sort of the addiction to, right? The addiction to the ways in which addictions of all sorts change brain wiring, for shorthand, and particularly in children who have the most plastic brains and are undergoing development of all sorts and are the ones sort of on the front lines now, at least, right, of this innovation and engagement. And adolescents who, where parents have less control of how much they are engaging, as they are required to be on all their devices for various academic and social reasons. What, as a psychoanalyst, would you say to parents who are, you know, sort of what what is the best thing to do here vis-a-vis staying curious, uh, but mindful that I have children? Yes.
No, I really appreciate your question, and it's one that I've been thinking about a lot. My inclination, and this is where I've been going with my older daughter, who's starting middle school now, and she just came home with a laptop, and now really all her friends have phones, and she doesn't. So I'm really in the hot seat. I need to respond to this. My sense about it is that, as you're saying, the technology is addictive. There's no way to just use it halfway. Once you're in, there's such an undertow. So my sense is that the kids need to be supported and empowered in 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 being leaders and offering, to one another other ways of being social. I don't think you can go in and stay out. I think you have to take a more assertive stance. So
Meaning basically be leaders in the in real life movement of
exactly.
being social,
Yeah.
which of course, in so many
Yeah.
instances for children and adults is so very important, and being lost in the sauce. Absolutely.
Yeah. And saying, not, oh, I left my phone at home, but no, I don't have a phone. I don't want a phone. I don't want to be addicted, or I prefer painting, or whatever it is, but just sort of taking a stance on it, as opposed to skirting around it.
Are there ways that parents can talk to their children about AI, that give it a context of, I guess, less likelihood of being drawn in this way that can be potentially a dangerous thing? That this is a machine. This is not a person. This cannot, you know, kids have all sorts of magical thinking, and really what we're talking about is adults who develop magical thinking about AI. And so that's how challenging it is. That's how
Yeah.
challenging it is. And how do we help them identify that to think otherwise is magical thinking and try to mitigate some of the dangers?
I love your questions, and that one feels so, so important. What's coming to my mind is, I remember reading this somewhere about, how to help girls who are adolescents, and body image, and all of the, sort of aggressive advertising that says you have to look a certain way. And the mother, I think I can't remember who it was, but someone was writing about walking around, in a magazine with her daughter and saying, "Look at those magazines. You see the women on front. What do you think about that?" And the daughter saying, "That doesn't look like anyone I know." So, in other words, having conversations. I showed my girls a replica, a companion bot that I created, to explore this with. And I said, "What do you think?" And they're like, "Oh my God, that's scary. What is it?" And so I'm trying to engage them in thinking about it, so that they won't fall into just using it in a non-reflective way, but being able to reflect and observe. I'm always pointing out, "Oh, wow, what do you notice? Oh, everyone's on their phone. Yeah, we can't make eye contact with anyone." You know, so I think that's what parents can do. If that, I think that was your question. What can we do? I think it's to to engage.
That, that we do know that basically just saying, don't do that, or I'm going to tell you the way it is and you need to do that, doesn't work very well. But
Right.
that question-centered parenting, to, say, what do you know? What do you think? What do you feel?
Yeah.
So that they can reflect on their own feelings
Yeah.
about those things. Certainly keeps the open communication. And of course, one of the dangers is that, in fact, a child goes down a rabbit hole and doesn't communicate about what's happening. So being able to have that open communication is so important. But being able to help your child develop their own sense of being able to reflect on their feeling states and not have to deny them or compartmentalize them. It's, and be unaware is really, as you say,
Yeah.
is so important.
And I would just add to that also, I think there is a place for education, to say people are getting hooked relating to companion bots. It's very, very attractive. I think it may be for these reasons, but what do you think? Like, why would someone fall in love with or have a best friend who's a robot, And then it's sad, in some cases they feel really bad and they hurt themselves. Or I would educate, I would explain, just as
Mhm.
we do with drugs, it
Yes.
kills brain cells, it makes people desperate. I mean, definitely point out the risks that are known.
As a mother who put academic papers about drug use on her daughter's beds with it,
Of
I'm on
course.
board.
Yeah.
On board. I think today this is really challenging for parents bringing up young children. That this is a frontier with not a lot of information to tell us how it's going to go,
Yeah.
and a lot of concerns already about everything from rewiring that enhances ADHD to these fully ado situations, and I think it is a very challenging time, and I think we psychoanalysts want to let parents know that we're a resource for dealing with this challenge as we are with other challenges
Yes.
for young people. And let's hope that the OpenAI folks are listening and thinking about how they can tap into this important resource that you are and the committees are and thinkers. They're really, they would love to capture this audience. So I hope that they will, I think these innovators would like to capture this audience. I'd like to believe mostly for the good.
Well, what's your sense about their interest in this audience?
I think they are uncertain. They are uncertain as to. I think they are aware that you know economically and audience wise there would be a concern about being replaced. Not just in our field, but many fields. And so I think that makes them unconsciously, reticent to engage in with someone that they can imagine would push back, or not want to move it forward. So presenting ourselves as you're saying, as a group that actually does want to engage and not shut down, but help guide direction so that essentially there are good outcomes as opposed to bad ones, and would be important in
Yeah.
elevating that message. Yeah. Well, this has been really illuminating, and I thank you so much for joining me today. And we will all look forward to seeing your book when it comes out, which will
Thank you
have
so
much more
much, Gail.
information. So timely. So I look forward to reading that. And thank you for today.
Thank you for having me on. I really appreciate it.
Thank you for listening in today. We at the American Psychoanalytic Association hope to introduce you to the many ways psychoanalytic thought affects the world around us, and especially you, through this podcast. We would love to hear your thoughts, questions, and requests. If you haven't already, please subscribe to this podcast on your favorite podcast platform. Follow APsA on Instagram, Facebook, LinkedIn, or X at psychoanalysis_ with the hashtag APsA podcast. And feel free to send a question or comment. You can find more information about the American Psychoanalytic Association by going to www.apsa.org and listen to more episodes and find bios of our guests online at apsa.org/podcast. If you found this episode useful, please share with a friend or colleague, and we will be back next month with another episode of Psychoanalysis and You. I'm Dr. Gail Saltz, and it's been my pleasure to be your host of Psychoanalysis and You. And now for some Freudian quickies. You sent in your questions for an analyst. I grabbed an analyst with an answer. Till next time.